A 67-year-old woman came into the emergency room confused, hypothermic, and with a blood glucose so low her brain was beginning to shut down. Her daughter had found her in the kitchen, smelling strongly of acetone, holding a bottle of rubbing alcohol in her hand. She couldn't say where she was. She couldn't say what month it was. Paramedics pushed sugar through her IV in the ambulance. It barely helped. This was the strangest part. She hadn't taken any medication. She hadn't fallen. She hadn't been outside in the cold. She lived with her daughter and ate 3 meals a day. She was on insulin for her diabetes, but her doses hadn't changed in years. And the smell on her breath, that sharp chemical smell of acetone, was the smell of a body in metabolic crisis. Acetone is not something the human body makes in large quantities unless something is very wrong. For about 6 months, she had been using rubbing isopropyl alcohol on her arms, legs, and lower back, 2 to 3 times a day. Her muscles cramped at night. Her grandmother, who lived to 93, had sworn by rubbing alcohol for cramps. It's just on the skin, she thought. Skin is a barrier. It can't really get inside. She had been buying the cheap green bottles of 70% isopropyl alcohol at the drugstore, 4 or 5 at a time. Her daughter thought she was using them to clean. She also had end-stage kidney disease. Her kidneys had been failing for years from diabetes, and she went to a dialysis center once a week to have her blood cleaned by a machine. In the month before she came to the hospital, she had missed several of those appointments. She had been feeling tired. She didn't want to sit in the chair for 4 hours. "I'll go next week," she kept saying. She didn't go next week. By the time her daughter found her, the alcohol she had been rubbing on her skin for 6 months had built up in her body to a dangerous level. She is brought to the emergency room where we are now. Upon arrival, doctors recognize that something is very wrong, but can't immediately say what. Her glucose is 38. Her temperature is 33 degrees Celsius. Her mental status is altered, but she has no signs of stroke, no fever, no infection on examination. They start her on glucose through an IV. They cover her with warming blankets. They draw blood for tests. The basic metabolic panel comes back with one strange finding. Her serum osmolality, which is a measure of how concentrated her blood is far higher than it should be. When the doctors calculate what the osmolality should be based on her sodium, glucose, and BUN, they get a much lower number. The difference between the two numbers is called the osmolar gap. The normal osmolar gap is about 10. Hers is over 40. That gap means that there is something dissolved in her blood that the standard calculation isn't accounting for. Something osmotically active that the body recognizes as a solute. The list of substances that causes an elevated osmolar gap is short. Methanol, found in windshield washer fluid. Ethanol, the alcohol in drinks. Ethylene glycol, the alcohol in antifreeze. Propylene glycol, used in some IV medications. And isopropanol, the alcohol in rubbing alcohol. When the toxicology lab tests for these specifically, methanol is negative. Ethanol is negative. Ethylene glycol is negative. Isopropanol is positive at 10 milligrams per deciliter. Her acetone level is 148 milligrams per deciliter. Normal is essentially 0. This is the strangest part of the case. She didn't drink the rubbing alcohol. The bottle in her hand was for her skin. So how did so much of it end up inside her body? There were 3 things working against her at the same time, and each one alone would not have been enough to harm her. Together, they almost killed her. Most people are taught that skin is a barrier, a wall that keeps things out. This is partly true. Skin keeps water out. Skin keeps most bacteria out. But skin is not a perfect wall. It is a selective wall. The outer layer of skin is made of dead cells held together by fats. Small molecules that are fat-loving can slip between those cells and pass through to the blood vessels underneath. This is how nicotine patches work. This is how fentanyl patches work. This is how hormone creams work. And this is how isopropyl alcohol, a very small molecule that loves fat, slowly crossed her skin every time she rubbed it in. A single application might absorb only a tiny amount, but she had been applying it 2 to 3 times a day over large areas of her body for 6 months. The total absorbed dose spread over that time was enormous, or rather, the lack of them. Healthy kidneys clear small alcohols out of the body efficiently. When alcohol enters the body, the kidneys filter it all out, and it leaves in the urine. Her kidneys had stopped working years ago. The dialysis machine did their job, but only once a week. Between dialysis sessions, anything her body couldn't process on its own was just accumulating. The alcohol that crossed her body had nowhere to go. When she stopped going to dialysis for several weeks, the alcohol that had been slowly accumulating was no longer being removed at all. It built up. and up. In this small science experiment, I take a glass and slowly drip water into it from a faucet, 1 drop every few seconds. If the drain at the bottom of the glass is open, the water level never rises. The water comes in, the water goes out. But if I close the drain, the water level starts to climb. The same number of drops are coming in, but there's no way out. This is what happened to her body. Isopropyl alcohol was dripping in, slowly, through her skin. Her kidneys, the drain, had been closed for years. The dialysis machine had been opening that drain once a week. Then she stopped going. The first part is hypoglycemia. Hypo, meaning low, glyc, short for glucose, which is sugar, and emia, meaning presence in blood. Low sugar in the blood. Isopropanol and its metabolite acetone both suppress glucose production in the liver. The liver normally makes new sugar between meals through a process called gluconeogenesis. Gluco, meaning sugar, neo, meaning new, genesis, meaning creation. The creation of new sugar. Alcohol shuts this process down. In a healthy person, this is why drinking on an empty stomach can lower blood sugar. In someone on insulin for diabetes, whose body has already been pulling sugar out of the blood, this is dangerous. Her insulin kept working. Her liver stopped making new sugar to balance it. Her blood glucose fell. The brain, which runs almost entirely on sugar, started to fail. First, confusion, then loss of body temperature regulation, then loss of consciousness. The second part is the acetone itself. When the liver processes isopropanol, it converts it into acetone through an enzyme called alcohol dehydrogenase. Acetone is not as toxic as the metabolites of methanol or ethylene glycol, which become formic acid and oxalic acid, respectively. Acetone is mainly a depressant. It slows the brain. It causes vasodilation, which means the blood vessels relax and open up, which is part of why she was losing body heat. It can also impair the heart's ability to compensate. Here is the part of the case that is most counterintuitive and most important. For methanol poisoning and ethylene glycol poisoning, the antidote is a drug called fomepizole. Fomepizole blocks the enzyme alcohol dehydrogenase. This stops the body from converting those alcohols into their toxic metabolites. It is life-saving in those poisonings. For isopropanol poisoning, fomepizole is contraindicated, meaning you must not give it. The reason is that the isopropanol itself is more dangerous to the brain than its metabolite acetone is. If you block alcohol dehydrogenase, you trap isopropanol in the body unchanged, prolonging the coma and the hypothermia. The same drug, the right answer for 2 alcohols, is the wrong answer for a third. What she needed was the opposite. She needed her body to process the isopropanol as fast as possible, and she needed the alcohol that was still in her blood to be removed mechanically. The treatment for severe isopropanol toxicity when the patient is unstable is hemodialysis, the same dialysis she had been missing. Doctors started her dextrose infusion to fight the low blood sugar. They wrapped her in warming blankets. They admitted her to the intensive care unit, and they restarted her hemodialysis, this time more frequently than her usual schedule. The dialysis pulled the isopropanol and acetone out of her body in a way her kidneys never could. Within hours, her mental status began to clear. Within days, her temperature was normal and her blood sugar was stable without continuous dextrose. 3 days after she arrived in the emergency room, she was discharged home. Isopropanol was first synthesized in 1920 by chemists working for Standard Oil of New Jersey. It became cheap to manufacture because it could be made from petroleum byproducts. It replaced ethanol in many topical uses because it evaporated faster, killed bacteria more effectively, and was harder to drink without getting sick from. By the 1940s and 1950s, isopropyl alcohol was in every medicine cabinet in the United States. It was used as an antiseptic, a cooling agent for fevers, and home remedy for everything from joint pain to insect bites. In the 1950s, hospitals began publishing reports of children who had been given alcohol sponge baths for fever. Some went into comas, some died. The mechanism was the same as what happened to this woman, but faster, because children have thinner skin and larger surface area relative to their body mass. Hospitals stopped doing alcohol sponge baths, but the home version of the practice, passed down from grandmother to grandchild, never fully went away.